Welcome everyone to another episode here, Doctors of Podiatry. I think we have a pretty interesting case. We have a young gentleman who has presented with a dermatological manifestation of unknown etiology. Huh? Exactly. So what I'm going to show you guys, young patient who has been battling this problem for many years. He has presented to several physicians. Maybe 11 years ago, he apparently maybe had a biopsy, a shave biopsy done. The history is a little bit wishy-washy. So what we're going to do today is I want to show you guys what the dermatological manifestation looks like. And I'm going to get let's come around here. Let's bring your leg around here. So he presents today with these kind of like ridges, right? 2, 3 little mountains. If you get a clear close-up, I want everyone to see there's these tiny little holes, right? Like little sinus tracts, like little tiny holes. And come over here. Look at this one. And if you look closely, there looks like there's a little bit of drainage. Have you seen drainage from these? Like little, if you put a Band-Aid and you take it off at the end of the day, is it a little bit yellow? Yes.
Yes.
So the patient just told me, just like everyone heard, if you were to put a Band-Aid at the end of the day, if you would take it off and look on the Band-Aid, right, he would see a little bit of yellow fluid. So these have been draining. So what we're going to go ahead and do, Doctor, we have the good fortune of having Dr. Ahmed here today, and he's going to go ahead and perform the procedure. So we're going to go ahead and let's keep an eye here. Very important. What we do is there's obviously very other important instructions. We have the bone, and I'm going to let Dr. Ahmed take it from here. He's going to explain to you guys what he's going to basically do, or maybe not. That's cool. So we're going to go ahead and a little anesthesia, a little pinch like that. This is what we're doing is we're injecting a little bit of lidocaine with epinephrine. Epinephrine basically vasoconstricts. It stops the bleeding on purpose because we're going to go ahead and perform. That's perfect.
So Dr. Martin
Okay.
is not here.
And just like that, we'll give it basically a minute. And now we're going to go ahead and take just get around here. We're going to take our punch. Okay. So now we're going to go ahead and...
It's all in here.
Oh, it's here? Okay, great.
You still want the 2, right?
Yeah. My pickup, please. Do we have a good picture there, Wesley? Let's get a real nice close-up. So all of our viewers can...
This is for taking it off.
Okay. So always, I like to always stay nice and perpendicular. Okay. Any discomfort? And I always like to ask discomfort. Any discomfort, sir?
Hmm?
Any pain?
No.
Okay. Any pain?
No.
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 Oui. Excellent. All the way down. We go all the way down, all the way down, all the way down, all the way. And then once we get there, we do that little wiggle motion just like Dr. Ahmed is doing, like that. And then slowly, you kind of push it down again. There we go. He's going to hold it there. And bingo. And there it is inside, which is great. 1 second. I'll get you a little... We want to always be very careful. Oh, never mind. And excellent. So now, 1 second. Okay. So, Wesley, I want you to focus in here. Okay, better yet. Can we get a picture of that? As everyone can see, we have a punch biopsy. It's a 2 millimeter. They come in different sizes, 2, 3, 4, depending on the clinical presentation. As everyone can see, please, over here, there is no blood. And the reason why there is no blood is because we used lidocaine with epinephrine. And epinephrine, again, constricts. It doesn't allow the vessels to actually bleed. And that's why we put a little bit of that, and we only use lidocaine with epinephrine in this office only when we do biopsies. We do not use lidocaine with epinephrine for anything else. It is a complete no-no. So what we're going to do is we'll put a little bit of antibiotic cream, just like this. Okay. Very little. That's beautiful. Add a little dab there. And that's it. Okay. So in closing, what we did today, young patient, dermatological manifestation. We don't know what it is, even though they kind of gave him an initial preliminary diagnosis. It hasn't gotten better. He's been putting foams, creams, ointments, who knows what else. So the first thing we want to do is identify the problem. Once we identify the problem, then we can make further recommendations as necessary. Fantastic case, very interesting. I love dermatology. I think it's something as you know, in the realm of podiatric medicine. I love it. I truly do. Like always, if anyone has any questions, please feel free to reach out to us. www.jawspodiatry.com, Instagram, Dr. Tojam, Jaws Podiatry, and our Facebook fan page. And last but not least, Jaws Healthcare YouTube channel. I'm going to definitely post once I get the report of the pathology lab, I will definitely just let you guys know exactly what this is. Okay? Have a nice day, guys.